Strep throat is a bacterial infection characterized by a sore and scratchy throat. Though it is responsible for only a minority of sore throat cases, untreated strep throat can lead to serious complications like kidney inflammation or rheumatic fever. Rheumatic fever may result in painful, swollen joints, a distinctive rash, or damage to heart valves. While strep throat is most prevalent among children, it can affect individuals of any age. If you or your child exhibit symptoms of strep throat, consult a doctor for timely testing and treatment. Symptoms: strep throat can present with a variety of signs and symptoms, including painful swallowing, throat pain that typically starts suddenly, red and swollen tonsils, occasionally with white patches or pus streaks, fever, small red spots on the soft or hard palate at the back of the roof of the mouth, swollen tender lymph nodes in the neck, rash, headache, body aches, nausea or vomiting, especially in younger children. You or your child might exhibit many of these signs and symptoms without actually having strep throat. These symptoms could be caused by a viral infection or another illness. This is why doctors typically perform specific tests to diagnose strep throat. Additionally, it's possible to be exposed to someone who carries the strep bacteria but does not show any symptoms. When to see a doctor? Contact your doctor if you or your child experiences any of the following signs and symptoms: a sore throat that lasts longer than 48 hours, a sore throat accompanied by tender, swollen lymph glands, a fever, problems breathing or swallowing, a sore throat accompanied by a rash. No improvement after taking antibiotics for 48 hours if strep has been diagnosed. Causes: strep throat is caused by the bacterium Streptococcus pyogenes, also known as Group A Streptococcus. These bacteria are highly contagious and can spread through airborne droplets when an infected person coughs or sneezes. They can also be transmitted through sharing food or drinks with an infected individual. Additionally, touching contaminated surfaces such as doorknobs and then touching your nose, mouth, or eyes can transfer the bacteria. Risk factors. Various factors can heighten the risk of contracting strep throat. Young age. Strep throat is more prevalent among children. Time of year. While strep throat can occur year-round, it's more common during the winter and early spring months. This period sees increased circulation of strep bacteria, especially in environments where people are in close proximity. Complications. Strep throat can lead to serious complications, even though antibiotic treatment can reduce the risk. Spread of infection. Strep bacteria can spread and cause infections in various areas, including tonsils, sinuses, skin, blood, middle ear. Inflammatory reactions. Strep infection may trigger inflammatory illnesses, such as scarlet fever, a streptococcal infection characterized by a prominent rash, inflammation of the kidney, post-streptococcal glomerulonephritis, rheumatic fever, a severe inflammatory condition affecting the heart, joints, nervous system, and skin, post-streptococcal reactive arthritis, a condition causing joint inflammation. Other complications. In rare cases, strep throat can lead to additional complications, such as peritonsillar abscess, a collection of pus near the tonsils, toxic shock syndrome, a severe and potentially life-threatening complication caused by toxins released by certain strains of strep bacteria, acute rheumatic heart disease, a complication of rheumatic fever that affects the heart valves, PANDAS, pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. Controversial, but some evidence suggests a link between strep infection and exacerbation of neuropsychiatric symptoms in susceptible individuals. Prevention. To reduce the risk of strep infection, practice good hand hygiene. Regular hand washing with soap and water for at least 20 seconds is the most effective way to prevent infections. Teach children to wash their hands thoroughly and to use an alcohol-based hand sanitizer when soap and water are not available. Cover your mouth when coughing or sneezing. Instruct children to cover their mouths with their elbow or a tissue when they cough or sneeze to prevent the spread of bacteria. Avoid sharing personal items. Refrain from sharing drinking glasses, eating utensils, or other personal items. Ensure that dishes are washed in hot, soapy water or in a dishwasher. Maintain a clean environment. Regularly clean and disinfect commonly touched surfaces such as doorknobs, light switches, and toys. Stay home when sick. If you or your child is showing symptoms of strep throat or any other contagious illness, stay home to avoid spreading the infection to others. Boost your immune system. A healthy diet, regular exercise, adequate sleep, and stress management can help strengthen the immune system, making it easier to fend off infections. Diagnosis. Your doctor will perform a physical examination, check for signs and symptoms of strep throat, and may order one or more of the following tests. Rapid antigen test. This test involves taking a swab sample from your throat to quickly detect the presence of strep bacteria by identifying specific substances. Antigens. Results are available within minutes. If the test is negative, but the doctor still suspects strep throat, a throat culture may be performed. Molecular polymerase chain reaction, or PCR test. Similar to the rapid antigen test, this test also uses a throat swab to detect the genetic material of strep bacteria. It is highly accurate. Throat culture. A sterile swab is used to collect a sample from the back of the throat and tonsils. Although it may cause gagging, it is not painful. The sample is then cultured in a lab to check for bacterial growth. This test can take up to 2 days to provide results. Treatment. Effective treatments for strep throat include medications that cure the infection, relieve symptoms, and prevent complications and spread. Antibiotics. If strep throat is diagnosed, doctors usually prescribe oral antibiotics. Starting antibiotics within 48 hours of symptom onset can shorten the illness duration, lessen symptom severity, and reduce the risk of complications and transmission. You or your child should notice improvement within a day or two of beginning antibiotics. If there's no improvement after 48 hours, contact your doctor. Children on antibiotics who feel well and are fever-free can typically return to school or childcare once they are no longer contagious, usually 24 hours after starting treatment. It's crucial to complete the full course of antibiotics to avoid recurrences and serious complications, such as rheumatic fever or kidney inflammation. Symptom relievers. To manage throat pain and fever, over-the-counter pain relievers like ibuprofen, Advil, Motrin IB, or acetaminophen, Tylenol, are effective. Avoid giving aspirin to children or teenagers recovering from chickenpox or flu-like symptoms due to the risk of Reyes syndrome, a rare but serious condition. Self-care. While antibiotics will usually clear up the infection quickly, the following tips can help relieve the symptoms of strep throat in the meantime. Get plenty of rest. Adequate sleep helps your body fight off the infection. If you have strep throat, stay home from work if possible. Keep your child at home until they have no fever, feel better, and have been on antibiotics for at least 24 hours. Stay hydrated. Drinking plenty of water keeps your throat lubricated and eases swallowing, which helps prevent dehydration. Eat soothing foods. Opt for easy-to-swallow foods such as broths, soups, applesauce, cooked cereal, mashed potatoes, soft fruits, yogurt, and soft-cooked eggs. Puree foods in a blender if necessary. Cold foods like sherbet, frozen yogurt, or fruit pops can also be soothing. Avoid spicy or acidic foods like orange juice. Gargle with warm salt water. For older children and adults, gargling several times a day can alleviate throat pain. Mix 1/4 teaspoon, 1.5 grams, of table salt in 8 ounces, 237 milliliters of warm water. Make sure your child spits out the liquid after gargling. Honey can soothe sore throats. Do not give honey to children under 12 months. Use a humidifier. Adding moisture to the air can reduce discomfort. Use a cool mist humidifier and clean it daily to prevent bacteria and mold growth. Saline nasal sprays can also keep mucous membranes moist. Avoid irritants. Stay away from cigarette smoke, which can aggravate a sore throat and increase infection risk. Also, avoid fumes from paint or cleaning products as they can irritate the throat and lungs. These self-care measures can help manage the symptoms while your body recovers from the infection. Have you ever experienced strep throat? What remedies helped you the most? Share your thoughts in the comments below, And don't forget to like and subscribe for more health tips and advice. Stay healthy.